Hey everybody, it's Kelly. Welcome back to another episode of Ask a Therapist. Today we're talking about conversion therapy. It's been in the news a little bit, and I think it's time we talk about it. Number one, what it is. Number two, what the history of it is. Like, how did we get here? And number three, why that should matter to you. Just so we're all on the same page, the actual definition we're going to be using right now for conversion therapy is any therapy that is meant to create in someone a change in their sexuality or gender identity to conform them to the heteronormative or cisgender expectation. Sometimes called reparative therapy. Right now, there's a push to call it exploratory therapy. That's a loaded statement, but given the study that has come out, and I use the term study very loosely, this May in the US, that's sort of one of the pushes right now. Quick understanding of the history of conversion therapy itself. In the late 19th century, some psychiatrists were labeling, and I'm going to ask your forgiveness for using this term, same-sex attraction as a medical problem, and were exploring ways to reverse it. Early 20th century came along, Sigmund Freud and his theories were being essentially misinterpreted to demonstrate how wrong being gay was, and therefore used to support this idea that homosexuality was like arrested development and therefore a very big problem. So we get to mid-20th century, more aggressive attempts start, such as aversion therapy. And aversion therapy is essentially when you pair stimuli with something that inflicts pain or some sort of other unpleasant experience, nausea-inducing or any kind of an emotion that's going to cause an aversion to that stimuli. You also at the same time have hormone therapy and an attempt to change hormone levels in people who are showing same-sex attraction. The expectation that maybe a woman who's attracted to a woman doesn't have enough estrogen, so pump her full of estrogen, and that's going to make her more attracted to men, right? That type of thing. That's all happening mid-20th century. All of that is part of conversion therapy. When the point of what you're doing is to change how someone is, that's a conversion, right? That is conversion therapy. So all of that being conversion therapy meant mental health professionals were using these tactics, aversion therapy, psychoanalysis, religious counseling, all of these things to change someone's sexual orientation, to change their gender identity, to make them straight and cisgender. In 1952, the APA, American Psychological Association, who is responsible for writing the DSM, which is the Diagnostic Statistical Manual, which is the book that people like me or other diagnosing mental health individuals use to find the diagnostic criteria that we use to diagnose our clients, right? To be able to have the same criteria across the board that we use to help our clients put a name to what is happening for them and also to standardize treatment. In 1952, homosexuality is entered into the DSM, officially pathologizing homosexuality as a problem. Between the 60s and the 70s, this begins to change in the world as a whole, which leads to, in 1973, a vote by the APA board to remove it from the DSM, and a vote goes to the APA body as a whole, which, for the record, only passes with 58% to remove it from the manual. It's actually replaced with something relatively similar at first, which is a concession for people to say, as a therapist, if someone comes into me and says, I am a man who's attracted to men and I don't want to be attracted to men anymore, I can still diagnose him with something and work with him in those ways and help him to not be attracted to men anymore. The problem is that whole trajectory, that whole string of events that I just talked to you about doesn't address the fact that it doesn't work. Conversion therapy doesn't work. There's no actual scientific evidence that it ever has worked. It can't exist because it doesn't. Less than 1 in 100 people who undergo conversion therapy ever claim to never experience, can use the term again, same-sex attraction again. Less than 1 in 100. That is 0% efficacy in any scientific study ever. There is no scientific study that would call that effective. In fact, in reality, there is actual evidence of the harm caused by conversion therapy. Studies have shown that a youth, someone under 18, who is subjected to conversion therapy is twice as likely to attempt suicide, as another LGBTQIA plus youth who was not subjected to conversion therapy. Now remember that any youth someone under 18 who identifies as part of the LGBTQI plus community already is 4.2% more likely than any other teenager to attempt suicide. So add that to sending them through conversion therapy, and there's a very clear problem here, right? We're aware of this. You can look at those statistics and say, oh, wow, being part of the queer community as a teenager is very harmful. You could look at it that way. In reality, the problem is not being part of the queer community. The problem is the way the world still pathologizes and understands what it means to be part of the queer community. The continuation of the pathologizing of someone not identifying as heterosexual or someone not identifying as cisgender is the problem here, not the actual belonging to the queer community. In 2022, there was a peer-reviewed study done by JAMA Pediatrics, which showed that conversion therapy and the ensuing problems that it created for people throughout their lifetime cost the U.S. $9.23 billion a year. Dollars a year. That's alcohol treatment, drug treatment, people who were on public assistance because of the things that they had gone through in their life and were not holding down jobs because they were not able to get themselves to a place where they could support themselves because of the psychological ramifications of going through conversion therapy in their younger years. Like, this is a damaging thing that people were doing to youth and young adults in an effort to make them normal. Can you imagine if all of that energy was put into helping them to love themselves as they were? Can you imagine? The bottom line is, someone who goes through conversion therapy, it most often is engaged in your younger years. But when someone has gone through conversion therapy, they have a higher risk of suicide. They have a higher risk of depression, of anxiety, of alcohol use, of drug use, of engaging in risky behaviors, in generally disliking themselves, which leads into all sorts of different things that are impacting them for the rest of their lives, impacting their relationships, their ability to do a good job in their work, and to fully appreciate and engage in their lives until they've had to do the work on their end to undo the things that society, their therapists when they were young, their family, all of those messages that they've gotten in the younger end, they now have to do the work to undo in order to live the life that they deserve to live all along. Every major medical and mental health organization in the world has denounced conversion therapy. Every single one of them. I'm just going to read you a couple of them, right? Just a couple. The American Medical Association, the American Psychiatric Association, the American Psychological Association, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychology, the American School Counselor Association, the ACA, which is the American Counseling Association, the WHO, World Health Organization, the World Medical Association. These are organizations that from their inception, their job has been to set the standard of care for people. Their entire existence is based in finding evidence-based practices. Now, quick aside, evidence-based practices is a problematic phrase, and I will acknowledge that because the push of evidence-based practices as the gold standard for therapy is problematic in a lot of arenas. But if we're going to say that we have to allow for people to engage in conversion therapy, I'm going to ask for evidence for that. Like, I'm going to ask you to show me why. I'm going to ask you to show me numbers, facts, statistics, back your stuff up, because that is where evidence is necessary. Okay? I can explain that evidence-based therapy thing better in another video if you need. The reason all of these organizations are against conversion therapy is the lack of efficacy. There is not information to show that's effective for anyone. There is such a high potential for harm for the client, for the patient. When you, as a therapist, say, because that's what I am, right? If I, as a therapist, walk into a situation with a client and I am encouraging them to do something from my standpoint that I think is important for them to do, I am abusing my power. That's not an appropriate use of power. when you're in a situation with a therapist, with a doctor, with a psychologist, with a psychiatrist, there's a power differential that the person with the license has to be aware of and has to be careful about. And encouraging your patient, your client, the person in your care to go in a direction that makes them more normal, that's an abuse of that power, which brings to light the ethical concerns of any kind of conversion therapy. And in reality, there's human rights violations in things like aversion therapy, shock therapy. These are human rights violations. And all of those are reasons why all of these organizations are against conversion therapy. Okay, so it's 2025 right now. And in October of this year, the Supreme Court of the United States is going to hear a case. A therapist named Kaylee Childs, I don't know if I'm pronouncing her last name correctly, but she, along with some other organizations, has brought this case through to the Supreme Court, challenging Colorado's ban on conversion therapy for minors. And the claim is that banning conversion therapy for minors is a violation of a therapist's freedom of speech and prevents the therapist from doing the best job possible for their clients. And as a Christian woman, Kaylee has claimed that it infringes on her religious freedoms in doing her job. I do not sit on the Supreme Court, but I am a therapist. And I'm licensed by a body similar to the one that she is licensed by. And we're both members of the ACA. I think she's still a member of the ACA. And so we are required to follow the same ethics guidelines. And the fact is, in our ethics guidelines, it does say that our opinion, our religion, our understanding of the world does not enter into the room with the client. So in reality, her religion doesn't matter in how she shows up in the space with the client. And while that's for the Supreme Court to decide, there are 20 other states in the United States that have similar laws that Colorado has. And therefore, if the Supreme Court sides with her, then that is going to set a precedent for these other states and for challenges in these other states. That could potentially be a problem. And that, along with a couple other reasons, is why I'm making this video as a whole. You need to be informed about what is happening in conversion therapy, how we got here in the first place, and what it is, and where these rulings can go. And bigger picture, humanizing this. I'm very aware that many of the viewers of this channel have gone through some sort of conversion therapy. Maybe you didn't know that's what it was. But if you were ever taken to a therapist in the hopes that you might not actually be part of the LGBTQIA plus community, like in the hopes that you might be straight, in the hopes that you might not be trans, in hopes that you might just be, and I hope no one has ever used this word, but I'm sure at some point they have, normal. I need you to know that wasn't fair to you. You should know that wasn't fair. There is nothing wrong with you. Well, I don't know you. When it comes to who you are or not attracted to, or who you know yourself to be, that doesn't make you wrong or bad just because it doesn't line up with who the world sees you as or who the world sees you needing to be attracted or not attracted to, right? Like that's not how this works. The historical pathologizing of the queer community is not your fault. And you paying the price for that, whether it's from your family, from society, from friends, from your church, from your job, I don't know where it's coming at you from, but you deserve to know that that should not have been subjected through a medical professional, through a mental health professional, through a teacher, through anybody in any kind of position of power. You should never have been subjected to the idea that you should change or become like everyone else in order to make your life easier or make everyone else's life easier. And if you were, I'm sorry. There's no reality in which who you are needs to be for the comfort of other people. And that's really what a lot of this comes down to. That's where this idea of conversion therapy started. And that is where the idea of bringing it back comes from, is that it makes some people uncomfortable for people in the queer community to be comfortable in their own skin. It makes people uncomfortable that people in the LGBTQIA plus community are challenging the status quo and living lives that don't look like cis-het lives. That makes people uncomfortable and they want to regulate that then. It's not your job to make everybody else comfortable. It's their job to figure out why their lack of comfort means you have to change. It's not your job to make everybody else comfortable. That's the bottom line here. So that is the state of conversion therapy right now. If there are more details that you want, please drop them below, or other things regarding conversion therapy that you'd like me to address, drop them below. And that's it for today. Thank you so much for being here. I will see you all next time. And until then, take care of yourselves and each other.